I'm Dr. Mendoza. I'm from the County Department of Public Health, and I love opportunities like this to talk about issues that are always smoldering. You all know that there are many headlines today around coronavirus and flu and all these things, and part of my job is to make sure we're paying attention to those silent issues, and this is one of those silent issues. I had the privilege of coming here, I guess now 2 years ago and a year ago, to talk about the opioid crisis. We are still in the middle of that. We still need to full court press on all of the issues that we've been working on with the opioid crisis, because if we lose sight of what we're doing, we're only going to lose ground. And my hope is that we don't have the same thing happen with vaping. With vaping, we are seeing it on the rise. We had a number of cases last summer that were very concerning, and I'll talk a little bit about that. But this is one of those smoldering issues that we have to always pay attention to, because quite frankly, this is going to outlast coronavirus. Okay, vaping and smoking and addiction are far more important as public health issues for the long haul than a coronavirus epidemic is. As much as we care about keeping people sick from that, this is something that we also need to pay attention to. So just to recap, for those of you in the audience who may not be aware, all of these e-cigarette devices have basically the same anatomy. They have a battery that gives you power. Generally these days they're USB. The Juuls that you've heard of are USB rechargeable batteries. There is an element that will heat up the liquid that is right here in the cartridge. So this heating element gets very hot. It doesn't burn though. So that's the key difference between e-cigarettes and regular cigarettes, is that there isn't any burning here. It's not combustion, but it's an aerosolizing sort of thing. And then the aerosol, the vapor comes here, and then it's inhaled by the user. So this is basically the anatomy. They've come in various forms over the years. You can see here on the far left. They started out looking like cigarettes, because the intention at the time was that these would be used as a smoking quit device. And we now know that that isn't entirely true, but we'll talk a little bit about that. And then over the years, they've changed. This one was quite popular. This is still in use, generally not among high school students, because A, these are hard to conceal, and B, they're not really that cool looking. But many of you have probably been at an intersection where you're waiting to turn left, and then a huge puff of smoke comes out like they just picked a pope in the car in front of you. That's this. Okay, when you see a giant smoke, that's this. Juul is the most popular one. You'll hear more about that today. And there are more, products coming onto the market, so be on the lookout for that. The e-liquids. So these are the liquids that go into the cartridges. They all pretty much have the same composition. The vast majority of the volume of this is a carrier liquid, sort of the solution that everything is dissolved in. Propylene glycol and vegetable glycerin. Generally, we think these are safe. These are in food products. These are relatively common chemicals in our life. And so generally speaking, we don't think that's an issue. There is still some concern about what happens when you heat this stuff up. But generally what we're really worried about are the other components. So nicotine liquid, present in about 90% of the e-cigarette devices, highly addictive and highly concentrated. One thing you'll learn later, I think, is the Juul device is made differently so that the really sour, difficult irritation that you might get from smoking a regular cigarette, you don't get that from Juul, because they use a different composition of the nicotine. And the nicotine, as you all know, is the addictive substance in cigarettes, and so we'll talk about what that means. And then there's this other category, and this is where we really worry, because nothing ever good comes out of other, right? So there are these little particles, tiny, tiny solid particles that can go way deep into our lungs. We think that's a problem because that can cause inflammation and lung disease. There are flavorants, and we'll talk about that. There are these volatile organic compounds, things that you see in industrial sites that is generally thought to be bad for our health. And then a bunch of heavy metals. And then sometimes you'll see cannabis, sometimes you see alcohol. So these are all very concerning components of the e-liquids. To give you some perspective, how many of you here will admit to eating microwave popcorn at some point in your life? Most people, all right? The buttery taste in microwave popcorn comes from this chemical right here. All right, so you'll learn later about popcorn lung. So microwave popcorn is generally healthy, we think, but when you are using that as a gas, if you're inhaling that chemical as a gas, as you would in e-cigarettes, there is a concern that it causes a condition called bronchiolitis obliterans, or popcorn lung. So this is a chemical that we've been looking at since 1985. Popcorn lung was an investigation in 2000, and then fast forward to just a couple years ago, in coffee grinding settings, this gas is being emitted, and we are seeing people with this lung disease also. So there is definitely something with these two chemicals, and we know that this is one of the many chemicals you'll see in the flavorants of e-cigarettes. So a little bit about the pulmonary disease. So for those of you who are so inclined, this is the normal bronchiole. These are the smaller airways in our lungs. Over time, when they're exposed to some of these chemicals, all this inflammation builds up, and then this is all the amount of space that is left for air to pass through. So you don't have to be a biologist to know that that's not a good situation for breathing. And so that is why a lot of people who have used e-cigarettes, particularly with the compounds that we're worried about, in the end have this condition, and this is not reversible. You cannot fix this. The only way to fix this is with a lung transplant. So this is something that you won't notice if you're using a vape in high school. This takes years to develop. And this is one of those things that you don't notice, you don't think it's there, but it's one of those chronic problems that we want to avoid. And I won't read you the details of this one, but this is a paper that just came out 2 weeks ago that started to look at some of the chemicals in e-cigarettes as changing the genetic makeup of our body. So this is called epigenetics. This is a field of medicine that is really very young. But what this field is looking at is the impact of chemicals and how that changes our genetic expression throughout life. So you're born with a certain amount of genes, but that is not a formula for your life. Our environment, the way we're raised, the exposures that we experience through our life are what turn on and off various genes in our body to make us who we are as adults. We now know that some of these chemicals have a way of turning on some of those genes. That's why some people who have breast cancer don't have a family history. And that's why some people who have a strong family history of breast cancer never get breast cancer, because it's not just about the genes, it's about how we live. And we know that smoking can do that, and now we know that vaping can do the same thing. So nicotine is a problem at the very moment an individual uses it. Okay, nicotine, it will raise your blood pressure, it will raise your heart rate, it will raise your breathing rate, it stimulates the central nervous system, which can feel good in the moment. Nicotine poisoning is rare but real, and as I said with Juul, 1 Juul pod is equal to 20 cigarettes, so 1 pack of cigarettes in 1 Juul pod, and I've heard of individuals using 3 Juul pods in a day. So that's like 3 packs of cigarettes in 1 day. It's very easy because it's concentrated and it's so much smoother than a regular cigarette. But the most important risk from my standpoint is that nicotine activates a chemical transmitter in our brain called dopamine. And dopamine is the pleasure hormone, if you will, and it's built to make you want more. And it is what's released when we have a good meal. It's also released after sexual intercourse. Alcohol, nicotine also releases dopamine. And so that's what you see here, that all of these rises within hours of use will raise your dopamine. And over time, the body starts to rewire itself to want this. Just for perspective, this is meth. Meth, we think, is even more addictive than cocaine and opioids and nicotine. So this is meth. This is the new problem. Our brains are developing until the age of 25 at least. We know this because when we do functional MRI scans of the brain, there are whole parts of the brain at age 12 that are not very developed at all. This is a good thing, because this is what allows us to learn through our adolescence. The problem with that is that it also allows us to learn things that we can't unlearn. So all of the physical habits, all the physiologic habits, smoking being one, vaping being one, as the brain develops throughout the teens and even into the early 20s, once your brain is hardwired to want that dopamine surge, it is almost impossible to get rid of it, because that is just part of how your brain is wired, and that is the brain that you have, hopefully, for the next 80 years. So that is really, honestly, why I think it's so important to be talking in high schools, because I do not want the next generation of kids to be hardwired for addiction in the same way that previous generations have been hardwired for opioid use or cocaine use or alcoholism or all the other addictive disorders. And then last year, I'm going to just fast forward through some of this, but last year in July, one of my colleagues got an email saying that he had seen 3 cases of young, healthy people presenting with shortness of breath and a history of vaping. They're all intubated in the ICU. That's really unusual. Okay, in the summertime, we don't see flu. We don't see the things that we're seeing right now in the hospital. These are healthy people who are intubated, who are on breathing machines because of vaping. And I actually believe that we were one of the first medical centers in the country to be on the chase for what we saw in the fall. Because for the coming months, so this is July now, 25th, 8 more cases of this were seen in the state of Wisconsin. This is an advisory that was issued by the state of New York, Governor Cuomo and Dr. Zucker, describing this unknown vaping-associated lung injury. We learned about more cases in North Carolina, 5 more cases. This was all new to all of us. We did not know what was going on. We did not know when this began, but it was definitely something on the horizon. We had a series of reports published in the scientific journals documenting this picture. This is not normal lungs. Okay, all of these white patches are not normal. This is all fluid and pus and things that you should not be seeing in the lungs of healthy people. And all of these people were vaping. We know that. So that prompted me to issue an advisory here in Monroe County. I did not make very many friends that week because I said we should all stop vaping. And I get that that's very wide, sweeping advice. But in the face of what we were seeing, in the face of the injuries and deaths that we were seeing in hospitalizations, I had no choice but to at least put out what we knew, which was that there was something out there in these vape products that was causing serious illness. So fast forward to January. So throughout the fall, there was a lot of attention to this compound called vitamin E acetate, which was thought to be one of those carrier chemicals in the vape juice. But when we were able to look back on this epidemic, and I can say now that we're pretty much done with this epidemic, it turns out that 82% of the individuals who had this condition had vaped THC. So they'd vaped marijuana. Now, there's a lot of debate about where that marijuana came from. We think that most of it was obtained from street sources, but we also know that some of it was obtained in dispensaries, which were, state-regulated, quote-unquote, legal for people who were in the medical marijuana programs. So all of this to say, I don't think we're done. I don't think we have a smoking gun, but if we were to call it today, it would be THC, which is why I'm very concerned about legalization of marijuana. And I understand that history is complicated for marijuana, but I do think that marijuana is by far well known to be addictive, and we now need to understand this better before we put our residents at risk for another epidemic. So, this is what happened with the epidemic. It rose and fell to the point that in December, January, we weren't even seeing any more of these cases. This is what happens when you have good public health. When we identify things, we identify the risk factors, we get education out there, and we hope that people make the right choices. So, but here you go, 82% of these individuals vaped a THC-containing product. So that seems to be a smoking gun. So just to put it out there, there are other countries in the world that have figured out how to use e-cigarettes as a smoking cessation device, they think. And part of that has to do with the fact that they use lower concentrations of nicotine and they don't market them to kids. We don't have that luxury here. We have found a way to do it incorrectly. We market it to teens and we use very, very high concentrations of nicotine. And so all that to say, we have no evidence in this country at this time to say that e-cigarettes are useful as a quit device for smoking. It is not FDA approved, and so we cannot endorse it as a quit device, even though I can tell you I have patients who swear that they stopped smoking because of this. We don't make policy based on individual stories, and we don't create guidelines based on individual stories. So even though it may be true for one person, we have no science to back that up. And so from my perspective, we've got to rely on science, and we've got to do more science and do more studies, and it's just not out there yet. So if you are somebody who's struggling with nicotine use, disorder, we want you to contact your doctor. There are a whole host of FDA-approved, evidence-based, science-based ways to quit smoking. So, I'm going to let Annalisa talk about the details of these vaping devices and all the marketing and all that has gone into it. But I want to sort of paint a picture for you of how we're going to get out of this, okay? Because I do think that this is not a crisis that we're just going to sort of wait around and hope that we get through this all. We've got to actually work together to get ourselves through this. And the way I like to do it is through public health and defining what is the problem. So this is kind of academic, but defining the problem in this case is vaping is a risk factor for addiction. That's the problem as I see it. 3 months ago we were trying to identify the causes of those lung injury cases, those deaths. That's a different public health problem. But as I see it, we want to define the problem as early adolescent vaping use causing addiction and other problems down the road. Because once we identify that, we can study it, develop programs to prevent, and then ensure that we have good policies on the books, both here in Monroe County as well as across the state, that help everybody to stay safe and healthy. And the best lesson that we can learn from is smoking. So this is what cigarette smoking looked like going back to 1880, okay? And so each of these colors adds up to this curve. And so the peak in use of cigarette smoke in all the different forms here was in the 1950s and 1960s. And in all of these, arrows here are policy changes that were put into place that individually made a little bit of a difference, but when you look back, made a huge difference. So now it's pretty clear that people understand that cigarettes are bad for your health. And I want to get to the point where we look at e-cigarettes in a similar way. If there is a role for them to be used in a health setting, let's figure out what that is. But until we know that that's true, we cannot say that that's true. And so we want to be accurate about what we know about e-cigarettes. So let's talk a little bit about what's happening here in New York State and in Monroe County, and we'll get into this in a little bit. But, what you saw on the previous slide is sort of parallel to what we see here in New York State. In red here is cigarette use among high school students, going back to the year 2000. And as you can see, there's been a steady decline overall in cigarette use. Yellow here is vaping. Okay, so we didn't really pay attention to this until about 4 or 5 years ago, 6 years ago. Huge increases, up to 30% here. We know it's higher than that now. What I want you to notice is for the first time in 20 years, cigarette smoking actually went up. Okay, in this last 2-year interval, the prevalence of tobacco cigarette use among high school students went up. And there's no reason to believe why that would be, except to assume that it is somehow related to vaping. Either people who vape then go to cigarettes, or they're using both together, so they're co-using these products. And so that's why we don't pay attention to this vaping issue, we're going to lose 80 years of progress with regard to cigarette smoke. This is the e-cigarette sales in the United States. What I want to point out, going back to 2013, is that there was no Juul then. That increase you saw in the last 4 years pretty much parallels Juul. Juul is the reason why this has become such a problem. And as you'll see, Juul is very, very marketable, very, very cool, and that's what our kids are using. There is no benefit that we know of for youth in particular to vape. And we know that there's a lot of evidence for harm. We know that adolescents who vape are 4 times more likely to use alcohol, 8 times more likely to use marijuana, and 22 times more likely to abuse cocaine. Again, we talked about the addictive potential. There was a risk of them exploding. Those older devices actually exploded, and people were sent to the hospital to burn units to get that addressed. The reality is that the full picture of risk is still coming. We don't know the full picture of risk for these devices, and we know that there's no documented benefit at this time. So here in Monroe County, we conduct a survey every 2 years called the Youth Risk Behavior Survey. And we ask a series of 100 questions, and some of you in this room have probably taken the survey. And we asked high school students if they had ever used an e-cigarette device, and the answer is 35%. Now, this is across the entire county, so I'm not going to break it down by district. 35% in 2019, it was 31% in 2015. Past month use is a different measure. It's related, of course, but past month use tends to refer to people who are habitual users of e-cigarettes. 23% in 2019, 20% 4 years prior. We asked students, why do you vape? Why do you use e-cigarettes? And they're allowed to select only one. 21% of them know that nicotine is the reason. So not only do they know it's there, they know that they get a buzz and they enjoy that buzz. So 21, 1 in 5 of our high school students said they use e-cigarettes to get a buzz. For relaxing, because their friends use them, to make the tricks and such with the vapors common. Flavors, 9%. So 1 in 10 roughly do it for the flavors. It is reassuring to know that marijuana and alcohol use are on the decline, which is good. My worry is that adolescents are substituting one addictive substance with another. And so in the end, we're not actually doing very much to prevent addiction down the road, because it doesn't actually matter what you're addicted to as an adolescent. It can be video games, it can be cigarette smoke, it can be alcohol. We know that whatever it is that you're addicted to as an adolescent hardwires your brain for addiction down the road. And typically when we're older, we have more resources, we can afford things that are more dangerous. So opioids and heroin and cocaine and other things. So that's why we're so worried about making sure we prevent addiction in younger adults. And so this is just a prevalence of use going up with each of the years in high school for alcohol, for e-cigarettes, and for marijuana. Roughly 30% of high school students use alcohol, e-cigarettes, and marijuana across all of the districts in Monroe County. We also know through the survey that there are things that we can do as parents, as schools, as churches to help protect our young adults from addiction. And we can talk all about the risks, but I think it's also important that we talk about the things that we can do in a positive fashion. And we call these protective factors. So we ask a series of questions about these protective factors on our survey, and one of them is agree or disagree with the statement that you get a lot of encouragement at your school. So in Monroe County, 62% of our high school students agreed or strongly agreed with that statement. 57% of them said, in my community, I feel like I matter to people. It's a good thing, okay? 84% of students know one or more adults that is not their parent that they can go to talk about important questions in their life, okay? These aren't just feel-good statements, okay? These statements are actually protective in many ways. And when it comes to addiction, we know that students who agree with those statements, those are the statements I showed you on the previous slide, when you agree with those statements, you have a lower incidence of using alcohol, marijuana, vaping, or smoking. So the conclusion here is this stuff isn't just touchy-feely. This is important. It's critically important that we find ways for our students to feel that they're feeling encouraged at school, to feel like they matter in their community. So we want to encourage students to volunteer, to do things in their community so that they feel that they're connected to something larger than just their school or their home. Having another non-parental adult is really important, and for a lot of people that's a coach or, another family member or what have you, but that's really important because that just speaks to the importance of communication. So with that, I'm going to pause. I'm going to turn it over to Annalisa Rogers, who's the director of the Smoking and Health Action Coalition of Monroe County.
My name is Annalisa, as Dr. Mendoza mentioned. I come from the American Lung Association, and I also am the director of the Smoking and Health Action Coalition. So one of the things I will say before I move on to the next slide, before I move on though, is that vaping has become a huge part of a culture in youth. And there has been so many things that have influenced youth use. And it's beyond what we as adults would normally think of as influencing. In fact, I don't know if many adults would have actually thought about it. Social media has been the primary way. When we most likely think about advertising, we think about the traditional forms of advertising. We think about it in the manner of newspaper articles. I'm talking about adults now. We think about it in newspaper articles, we think about it in TV, and those are the main ways that we think about advertising. But we don't usually think about it in terms of social media and how influencers through Snapchat, how influencers through Instagram or TikTok are actually using those platforms to kind of help promote it. And the thing that people don't know either is oftentimes the people that promote it through these social media sources, they're actually being paid to promote this. And so while we know that tobacco industries, it's $1 billion industry, and they spend $1 million an hour in just promoting and advertising the product, what we don't know yet is how much money they're actually spending advertising through social media influencers. But it works, and if it didn't work, they wouldn't use it. But because they consistently use it, and because we consistently see it through media platforms such as TikTok, or I'm sorry, not TikTok, such as YouTube even, or through some of those other channels, we know it works, and they're going to continue to use it to get the next number of you utilizing the product. So I'm not going to belabor the point of some of these statistics, because I know Dr. Mendoza had spoke of them earlier, but you'll see that from grades 9 through 12, just from 2014 through 2018, there has been huge increases in youth use. And so what does that mean for us now? As Dr. Mendoza mentioned, there seems to be a correlation between youth using e-cigarettes as well as youth using traditional combustible cigarettes. So where you'll see where the numbers are consistently high with e-cigs, cigarettes have been low for the longest point in time until most recently, where you'll see a lot of youth who have never used cigarettes and have got the messaging that cigarettes are really bad for you are now at the point where they're starting to use it. And as Dr. Mendoza mentioned, there seems to be a correlation with the e-cigarette use. So, how did we get here? It's a question that I've often asked myself. How do we get from the point of, kids not using cigarettes to all of a sudden they're using a lot more? And how is it that e-cigarettes have become such a popular way of youth using something that is very addictive? You'll see that adults actually only use it at a rate of about 3.8%, and the largest number of users are actually those that are in high school. Now, as Dr. Mendoza also mentioned, when e-cigarettes first came onto the market, it was promoted as a device that could actually help people quit smoking. And as you see, with the adult use currently, that can't possibly be true. If only 3.8% of adults are using it, then where are we going with that? It's not accurate, but we do see the highest numbers of youth using it. And so it has been a huge problem. It has been a huge problem, and it's consistently a huge problem. I actually frequently go into various schools on a regular basis, and I have talked to teachers, educators, and even some parents, and I've been given huge boxes of items that have just been confiscated from the students within the schools. So while it seems like things might be kind of leveling off, it is still a huge problem in terms of youth addiction, because right now we still don't necessarily have the tools available to help kids get off of the vape products. So the easiest and the best thing we can do right now is to prevent them and ask youth not to use the products at all. And believe it or not, people like me aren't the ones that should be carrying the message. It's actually youth who should be carrying that message to each other. Because I'm a dinosaur compared to some of the youth. I don't know what I'm talking about, but youth actually will listen to other youth. So we need to utilize and empower the youth voice so that they can have those conversations with their peers to help with that prevention effort. And as Dr. Mendoza also mentioned, it is not an FDA-approved product, and it is not a safe product. So there are more studies coming out, but from what we understand and know right now, it's not anything that we should be putting into our lungs. So here's some of the popular brands. They have hides, puff borers, Soren, pen pal vaporizers, but still, the most popular product is Juul. And one of the reasons why Juul is still one of the more popular items is because it's very discreet and it can be hidden. It actually can come to the point where people are actually kind of blowing it into their sleeves. And so some people aren't aware that people are actually vaping within classroom settings even. So because of that, it is one of the more popular items. And it's also very easy to hide. A lot of parents aren't still aware of what the Juul products look like. And if they don't know what it looks like, they don't know that what it is that they're looking at. So a Juul pod looks just like a regular USB thumb drive, and they wouldn't be able to distinguish the two. So one of the biggest issues with vape products is the flavors. And we call it the flavor trap, and we call it for a very good reason. How many of you would actually enjoy the flavor of just straight up tobacco? I don't see not one hand. If any of these products that came out with just straight tobacco, I don't think we'll be seeing the issues that we're seeing today. But now we've got nearly 8,000 or more different products out there that have these wonderfully sweet flavorings and smell great, and it's very enticing to you. As you'll see, some of them actually mirror cereals that we use on a regular basis. So Captain Crunch is one of them. Apple Jacks is this one. So all of these things, it's familiar. And what happens when you're familiar with something? You're more accepting of it, and you're more likely to use something like that because it seems like it's familiar to you. So tobacco marketing, $186.9 million is spent marketing annually in New York State alone. And the U.S. Surgeon General concluded that tobacco marketing causes us to begin smoking. In terms of marketing, it goes so much further than that. And it goes further than in the sense that if they can promote it in such a way that it doesn't feel like you're being promoted to, then you're going to be more likely to use it. And so I think of things like things that make you feel good, things that make you happy, things that kind of elicit a response, things that seems like your friends are using it. Because your friends are using them, why it must be safe for you to use. And so that is one of the many ways that they market it. And so Juul in particular was really successful with this because when they showed their videos, they always showed kids in groups who wanted to be they showed kids in groups. They also showed kids utilizing those products. They showed it in bright, vibrant colors. And all of those things have a way to elicit a response and make a person think that those types of things can be acceptable. But they also use industries like fashion as well to kind of help promote that, and the rap culture in addition to that. They also use celebrities to promote it. And so this is kind of some of what I was talking about. I mean, who wouldn't want to be the cute kid up there smoking a vape product? I mean, that's how they popularized it. But also, too, in addition to that, they also made it seem as though it's something harmless. And that's something that the tobacco industry had started to do from the start. They promoted the product as a safe product, as a healthy alternative, and because of, I don't want to say our inability to kind of catch up, but it always seems like at this point we're 7 steps behind. You know, they've done such an immensely good job of promoting this product. Public health is kind of trying to catch up, saying, hey, wait a minute, hold on a second. We can't back up your statements in terms of it being a healthy product. We can't back up your statement saying that it's anything healthy in any way, shape, or form. And again, we're kind of catching up to that. So these are just some of the other sources that we see lots of e-cigarette and traditional tobacco advertisements. We see it in youth-rated films. We see it in retail stores. We see it through internet, a lot of it through internet, TV, movies, and newspaper. But one of the other things that we're starting to see a lot more smoking in is in streamed videos like Netflix and Amazon and those types of things, Amazon Prime. So we're seeing a lot more of that happening on a regular basis. And all of that goes towards changing the sense of perception of what's normal behavior and what's not. The more often a person is exposed to something, the more likely they are to accept that as something okay too. So that is messaging that we really want to strongly reiterate and say that it's not true. There are over 400 different chemicals that we have found so far that are in e-cigarette products. So we've seen, as Dr. Mendoza mentioned, propylene glycol, there's glycerin, there's flavorings in it, but we've also found things like acetaldehyde, acrylamide, well, you get the point. If you can't say it, you shouldn't vape it, right? And the thing about it is, too, is that when you're looking at vape products, there's a lot of times you don't exactly know what is in the product. A lot of times it ranges in the amount of nicotine that's actually in it, but also the different ingredients in and of itself that they say is in it. I mean, I think about it in terms of looking at a box of cereal. I can go to a box of cereal and I can see exactly what's in that box of cereal. You can't necessarily say that for e-cig products. And if you don't know what's in it, you probably shouldn't vape it because you don't know whether or not it's going to be something harmful for you. Here's some of the impacts on you. The chemical flavorants can cause irreversible lung damage. It can impact your cellular development and cause popcorn lung, as Dr. Mendoza pointed out earlier. It can lead to issues such as COPD, asthma, and oxidative stress, and cause inflammation in your body, and also alter your DNA structure, as we mentioned earlier. But nicotine addiction as well. I used to work for Adult Protective many moons ago. And one of the gentlemen that I worked with was trying to get off the heroin, and he also smoked. He was able to kick his heroin habit. But one of the things he mentioned to me was one of the hardest things he's ever had to try to give up was nicotine. So these are some of the things you'll actually see with youth who utilize e-cigarette products. You might see increased risk-taking. You might see some psychological distress, difficulty concentrating, impulse control issues, brain development, cognitive impairment is something that definitely happens with nicotine use. You might find them to be more irritable. Okay, that's just about every teenager I know. No, I'm kidding. Well, at least every teenager in my family. Impatience, anxiety, yeah, that's definitely my nephew. Sorry, let's skip that one. So teens who use tobacco products or nicotine products, 4 times more likely to drink alcohol, 8 times more likely to use marijuana, and 20 times more likely to use cocaine. So when we think about habits and trying to change habits from the start, this is one of the major reasons why we wanted to focus on youth prevention, because we understand that nicotine can be considered a gateway drug. And because of the way it does change and alter the dopamine levels in your body, it makes you a little bit more susceptible to utilizing other products. And smokers who are 2 times as smokers are likely 2 times more likely to relapse after battling with substance use disorder or drug addiction. And again, referring back to the gentleman that I used to work with, he would definitely agree with that statement. It's just a couple more statistics that shows you high school use. So we have made a lot of gains with, recently with e-cigarettes. And some of the gains include things like federal and state regulations on flavors. Non-jewel-based pods with multiple flavors are now sold and then placed on jewel to use. Compatible pods. But New York State what we've done is a 20% sales tax on retail price of e-liquid or product with e-liquids. Tobacco 21 was recently implemented, which has been fantastic. We know that it works because there are studies out of Massachusetts that illustrate that with the inception of Tobacco 21, that there has been a significant decrease in utilizing the product. Retailers have to be licensed in New York State and are charged an annual fee. They have to renew on emergency 90-day ban flavored e-cigarettes. But here's also some other things that are pretty exciting in my world for us with the proposed New York State bills. Now, they're proposed and we have no idea if they're going to go through, but we're hopeful. And one of the biggest things that we want to see for sure is the ban on flavors. Now, there is a ban on flavor with the exception of mint and menthol. But we understand, and the American Lung Association supports that in order to really curb youth addiction and the impact that cigarette smoking can have in minority communities, that eliminating mint and menthol and all flavors altogether will be the best approach for us to really eliminating use of tobacco and nicotine products. So, for educators, parents, teachers, one of the best things that you can do to kind of help us in this prevention effort is to really educate yourself, become informed about what the issue is, also learn a lot more about the products, become more knowledgeable about what, where, and how these products are, how they appear in homes or in schools. Understand what the dangers of the products really are, especially with the chemicals and nicotine and the flavors. Understand how it can impact youth bodies. Understand the signs of addiction and the differences in behavior when a youth is utilizing a product, and the impacts on athletes or classroom performances. The second part you need to do after you've done your own education is educate your youth, educate your child. Explain to them what it is that they're using, why it's dangerous. And I have to also say, don't be punitive. There's been a lot of parents that I have talked to that, they've done things like taken away phones, but they don't really have a conversation with their youth about the dangers of this product. And what that has the potential to do is kind of push kids more away from having those really productive conversations. So don't push, just converse. Provide education, give them the information. Even if you don't think they're listening, continue to provide them the information that you have learned about the dangers of nicotine use. And discuss with them resources. Sometimes if your child isn't using, they probably know someone who is. So provide them resources that they can openly share with their friends. And I will also say, make sure that if you have a youth that is utilizing the product, it's going to take a team. It's not something that's really easy for a person just to quit cold turkey. There has to be a team. And so that team should consist of the educators, it should consist of parents, it should consist of your pediatrician. And if you have access available to cessation tools like New York State Quit Line, using some of those counselors can go a long way in really helping a youth quit. And so that kind of goes to my point about seeking help. Making sure that you make all of those contacts and you present the information to them so that they understand why you're willing to help them quit. Be supportive, work with your counselors, and definitely utilize the resources available to you. So here's some of the other resources we were talking about. The American Lung Association has Not on Tobacco, which is a nationwide cessation program for youth between the ages of 14 and 19. The Truth Initiative is a really good one. They have a text to quit line, and I've actually been on that one, and it's pretty decent. Youth Tobacco Cessation Collaborative is another resource. Project X and In-Depth is one that is more specifically tailored towards schools, where schools are learning to not take a punitive approach to treating tobacco addiction. And that concludes my presentation.